record.
This is our article discussion video on paternalism. I'm Amy and that's Leslie.
So our question of the day for this article discussion is, how do Ulysses contracts relate to paternalism? And first we're going to start by defining these terms to make sure that we're all on the same page when watching this video.
So defining Ulysses contracts, a Ulysses contract acknowledges that we're weak and human and likely to cave. So we create a constraint. We make it a deal in advance that we can't have overwritten later when we're faced with temptation or are of sound mind. So one of the things that I do is I work in the ER as an ER tech, and one of the things I see a lot is DNRs being revoked. And so with that, it's basically like a DNR is essentially a Ulysses contract that you make at some point when you are either coming down with a diagnosis or, when you're slightly getting older, like 40s, 50s, etc. And you decide, I don't want life-saving support. And eventually, some people who are powers of attorney can override that DNR and get rid of it, which kind of goes with the paternalism, because it's verbal and physical interventions used to provide more adequate care for a patient regarding what is best for their safety and overall well-being. So for some people, their power of attorneys may override their decision of a DNR because they think that's a better option for the patient. Maybe this person, coded just because they had too much of something. It was just a quick, easy fix, and it wasn't like a medical diagnosis. This can be overrode if the power of attorney goes back on it. And this is like a really great example of how a contract can actually be broken.
Yeah, absolutely. That was the perfect definition of the Ulysses contracts and paternalism. Another way that helps me remember paternalism is, let's say you and your friend were going shopping, and before you go shopping, you're like, oh my gosh, do not let me buy anything. I don't have the money for it. Like, do not let me buy anything. So that's the Ulysses contract that you made with your friend before going shopping. But then if you see this shirt that you like and you're like, oh my gosh, I need this, I'm going to buy it. And your friend would step in with paternalism and say, no, beforehand you told me to not let you buy anything. But your autonomy could kick in and say, oh no, it's fine. I saw this shirt. I think I have enough money. I work this weekend extra shift. It'll be okay. So you, with autonomy, you're putting up a really good argument saying why you need this shirt. And that's your friend to decide with paternalism whether they should step in with interventions or decide to let you use your autonomy to make your own decisions because of the argument you put up and the motives of your life, because it is your decisions. All right, and then we also are going to discuss how these two compare, the Ulysses contracts and paternalism. So some of the similarities we came up with is both are used to ensure the patient's safety and well-being. So something that relates to my major as a psychology major is if a patient was in a situation where they created a Ulysses contract when they were mentally stable and then became unmentally stable, unable to make logical decisions by themselves, this is where a medical professional may step in with paternalism and say, hey, you made this decision when you're mentally stable. The circumstances have changed. I think this should happen. But sometimes the patient might refuse the treatment because they are not in the right state of mind to make those difficult situations. So that's where the argument would come, where should the medical professionals be allowed to use paternalism and override those initial Ulysses contracts? Another similarity is both include restricting someone's freedom. So the Ulysses contracts are saying that this is the plan we have, this is the plan we're going to go with, you initiated this, and this is what's going to happen in the future, which is saying that you are not supposed to change your mind no matter what happens. And paternalism is also restricting the freedom because it is a medical professional in most cases, or even just like a parent or a friend saying, I don't think you should do this. I'm going to intervene in the situation and stop what you're trying to do. So both the Ulysses contracts and paternalism are taking away the freedom of the person creating the action. The final similarity that we came up with was contracts restrict doctors from deciding what is best based on medical needs, whereas paternalism restricts the patient's ability to care for themselves. So basically, like I just stated, the contracts are based on like the medical needs of the patient, and they're trying to do what's best for them mentally, physically, whatever state of being that the patient is in, whereas paternalism restricts someone else's ability to do an action for themselves using that autonomy.
So with those similarities, we came up with several differences also, such as who initiates the decision-making process, because in the contracts, it's usually like a patient who's kind of coming up with it, whereas with paternalism, it's more of a medical professional or somebody who is highly qualified to kind of say, okay, this is what we're doing, this is how we're going to handle the situation. And the contracts are typically brought up by a patient or, you know, a family member who's got that power of attorney. Maybe it's like the daughter of a dementia patient who's saying, okay, once mom hits this certain spot, that's what we're going to do. Another difference is we found patient rights such as the right to refuse treatment, give informed consent, and the right to private care are more prominent with paternalism versus with contracts, because with paternalism, you have a little bit more of that freedom to say, like, no, I don't want to do this treatment. I want to refuse it. I want to give consent for this procedure. I want, you know, private care, and I don't want all of this other stuff. Whereas with the contracts, you've kind of already made like this is what we're going to do. This is the plan of action. Now I don't have a right to refuse this treatment. For instance, if you get diagnosed with cancer and you say, okay, I'm going to be doing chemo for however long it takes to fight this, and that's your contract that you made with the doctor, and your next appointment you find out it's stage 4, it's spread everywhere, and you decide, I really don't want to do that anymore because there's, you know, not as much of a chance, your doctor has to stick with that contract, and they can't go back on it and say, okay, I understand and I get that, and whatever. Whereas with paternalism, they can understand that, you know, we're giving you informed reason as to why you might want to continue, but still your right to refuse this treatment and the right to, you know, not do it.
Absolutely, I totally agree.
So with Ulysses contracts relating to paternalism, we have a quote, and it says, given the considerable practical uncertainty about when such contracts can be enforced, changes would be needed in the law to ensure that doctors and patients know what is acceptable in relation to Ulysses contracts in medicine.
Yeah, so that quote from the article is basically saying that both medical professionals and patients need to make aware with each other that the Ulysses contract may not always be able to take place if the contract is necessary in medicine for the well-being of the patient. So, moral of the story, it's saying that if circumstances do come up that weren't initially planned in the patient's health contract, that changes may need to happen, whether the patient is in the mental state of mind to take part in those decisions or not. Because there could come up a situation where a person is unconscious and they might be, they broke their leg 4 weeks ago, and their plan is, I am going to go to physical therapy every week for 2 months, and I'm going to go to those appointments no matter what happens. Well, if they get in a car accident and become unconscious, they're not going to be able to go to physical therapy every week for those 2 months. So the doctor is going to have to intervene, change those plans, even if that patient initially said, I am going to go to these appointments no matter what happens. So I would think that would be a more scenario-based example of what a realistic situation of this would be, because crazy things happen all the time like this, and doctors have to intervene with the patient's schedule. In the article, the author also stated that they believed paternalism is in the best interest of the patient by allowing the medical professionals to make healthcare decisions when the patient's ability to determine treatment is unstable. And I completely agree with that, because there's so many situations where this happens, and it would be terrible for the patient if they needed care and they weren't able to receive it because the doctor wasn't allowed to make those decisions.
No, I totally agree with all of that. And I think that truthfully, there's a lot of case by case things, and there's not really a right answer to which one is better. It really just depends on, you know, the situation at hand. But
So that was our presentation on paternalism and the Ulysses contracts, and we hope you enjoyed.